Hello, my name is Ann Gainey, and I work with the Minnesota Community Health Worker Alliance. The Alliance is a statewide nonprofit. It's dedicated to health equity, and it works with CHW strategies as a method to reach health equity.
My name is Connie Norman, and I graduated in 2016, and I now work as a community health worker at Sanford Health in Bemidji. When I first started, they didn't have a community health worker, so being the first community health worker, building things from the ground up has been my favorite thing to do. But working with the patients and the providers every day is probably my favorite thing to do.
My name is Randy Sue, and I graduated NTC in 2015, and I am currently a community health worker for Red Lake Nation Homeless Shelter. I didn't get a job doing community health work straight out of the program, but I did manage to use those skills for the past 2 jobs that I had since graduating. And now that I'm actually a community health worker, I'm really into it, and it's really wonderful.
My name is Ben Cahill. I am attending 2021 to 2022, and I decided to join the program because I have a big passion for social justice, and I'm excited to address certain disparities in the community. A friend of mine, who is also going to be my internship instructor, Connie Norman, actually pointed me this direction because of my passion for social justice and equity.
My name is Wendy Potratz, and I teach all the classes in the Community Health Worker program here at Northwest Technical College. I also teach in the Health Science Broadfield program and the Gerontology program. I've been here for 9 years. My most recent job before coming here was I was a case manager for the Healthy Heart Project for the Leech Lake Band of Ojibwe.
CHWs are the health equity workforce. They are individuals who come from the community that they serve. They are trusted by that community and have a shared life experience with that community. They help clients with the social determinants of health, things like transportation, income, employment, food access, housing, all of those things that impact health and the success of healthcare. Because
I worked in kind of the medical area prior to coming to Bemidji, getting to know Wendy was one of them. Still one of the highlights of being in Bemidji is being able to work with her.
So one of my best memories in this program was actually being able to take a skill that I had already worked on through an organization that I'm a part of, and we plan a lot of events, and I was tasked with making a mock health fair, and I was able to take the skills that I already had and really hone them in, and then show some of my other fellow students how to actually really do that. And I think that's something that I really enjoyed.
Some of the favorite things that I like about this program are that the things that you learn in it aren't only applicable in the healthcare field. Learning things like conflict resolution, learning about emotional intelligence, addressing conflict in a non-judgmental way is actually really helpful for everyday life as well.
Students coming into this program should expect to kind of have their eyes open to things that they've been seeing, but now things kind of make sense. We learn about social determinants of health and reasons why people may or may not be healthy. And they can expect to do activities that will help them practice what they're going to do out in the real world.
CHWs often do their work beyond the clinic walls or beyond the organization's walls. They meet people in their homes through home visits. They can meet people in city parks, in coffee shops, public libraries, schools, childcare centers. They go where their clients are.
Just in the last year, we've updated our curriculum. We've added a few new components to that. There's a lot of research coming out regarding the social determinants of health and trauma-informed care.
When you start here, it's not a long program, and you can take it where you want it to go.
My goals after the program is done is to start practicing as a community health worker.
Many successful graduates of the program who are now out working in the field and making a positive difference. I'm also very proud that this program has been recognized statewide and we're bringing awareness to the needs of community health workers in the rural area.
And CHWs are very effective. Studies show that there's a minimum return on investment of $3 for every dollar invested. And that's a good investment, but it goes beyond that. CHWs improve the quality of healthcare and healthcare outcomes for their clients and the organizations they serve.
When someone is interested in a program like this, the one question I would ask is, do you have a heart to work with people? And is that your passion to actually walk the journey with people to help them?
So for anyone considering taking this program, I really encourage it, because if you really want to help people and be that boots on the ground, this is how to do it. This is definitely the way.
If someone's interested in the program, they can contact the school here and connect with our admissions office, or they can reach out to Distance Minnesota, since we have an online program.